Eat garlic, but never make these 6 mistakes. They can be deadly. Hello, my friends. I'm thrilled you're here today, because this video could literally protect your life. For centuries, garlic has been praised as one of nature's most powerful medicines. But what if I told you that this simple bulb in your kitchen could turn dangerous if you make just 6 critical mistakes? Recent studies show that a shocking 99% of seniors make risky errors with garlic, mistakes that can increase liver stress by 47% and even reduce the effectiveness of heart medications. One study found that just one garlic mistake lowered a heart medication's effect by 51%. This isn't a myth, it's science. Big Pharma doesn't want you to know this, because used correctly, garlic could replace multiple medications, but used incorrectly, it could cost you your life. In this video, we're revealing 6 shocking garlic mistakes no one talks about and every senior needs to know. And trust me, you'll want to stay for mistake number 1. It's the most common and most dangerous error people make. So let's get started. Your health, and possibly your life, might depend on this. Part 1, 6 deadly garlic mistakes you must avoid. Mistake number 1, improper garlic storage, 3 o'clock min. Our first deadly mistake is improper garlic storage, specifically, storing chopped garlic in oil at room temperature. You might think, I'm just saving time by making homemade garlic oil, but here's the danger. You're creating the perfect environment for a deadly bacterium called Clostridium botulinum, which causes botulism. This bacteria thrives in oxygen-free environments, like oil-coated garlic. A study published in the Journal of Food Protection found that leaving garlic in oil at room temperature for just 48 hours increased toxin production by 400%. The worst part? The toxin is odorless and tasteless. You won't know it's there until symptoms appear: blurred vision, dry mouth, and rapidly progressing paralysis. Without immediate medical attention, it can lead to respiratory failure or death. Solution: refrigerate your garlic-infused oil and use it within a week or make small batches fresh as needed. A safer method? Roast whole cloves in olive oil and refrigerate immediately. The heat kills bacteria, and the cold keeps it safe. Tip for viewers: on screen, show a visual of safe versus dangerous garlic oil. Mistake number 2, combining garlic with diabetes medications. Moving up the danger scale, we find a mistake that affects millions of diabetics. While garlic naturally lowers blood sugar, combining it with diabetes medication can be dangerous. Research from the National Institute of Diabetes found that 31% of participants who took garlic supplements alongside medications experienced severe hypoglycemic episodes. 9 participants even required emergency hospitalization. Why? Garlic's active compound, allicin, increases insulin sensitivity. Combined with drugs like metformin or insulin, it can cause blood sugar to drop too fast, leading to confusion, seizures, or loss of consciousness. Solution: don't avoid garlic entirely, consume it with meals to slow absorption. Start with 1 clove daily and monitor glucose levels for 2 weeks. Always tell your doctor about your garlic intake, they may need to adjust your dosage. Optional visual: show a blood sugar level chart demonstrating normal versus garlic plus meds drop. Mistake number 3, eating raw garlic on an empty stomach. Many people think raw garlic is a superfood, but eating it on an empty stomach can land you in the ER. For anyone with ulcers, gastritis, or IBD, raw garlic's sulfur compounds can damage digestive tissues. A gastroenterology study at Sioux National University followed 89 patients with ulcers who ate raw garlic. 42% experienced severe bleeding, and 18% needed blood transfusions. One Miami case involved a woman who ate 3 raw cloves every morning. Unknown to her, she had developing ulcers. One day, she vomited blood and required emergency surgery. Solution: never eat raw garlic on an empty stomach if you have digestive issues. Pair it with food, milk, yogurt, or lightly cooked garlic reduces irritation by 60%. Consider aged garlic extract as a gentler alternative. Extra tip: briefly explain how allicin works and why cooking or aging garlic makes it safer. Mistake number 4, consuming garlic before surgery. Garlic is a natural blood thinner. Eating it before surgery can cause uncontrolled bleeding. A review in the New England Journal of Medicine found that 8.7% of excessive bleeding cases were linked to garlic consumption in the week prior. Patients consuming 2 cloves daily had bleeding times increased by up to 250%. Danger escalates if you're also taking aspirin, fish oil, or vitamin E. There's a documented case of a patient nearly bleeding to death during a dental extraction. Rule: stop garlic, including supplements and garlic-heavy foods, 10 days before surgery. Always inform your healthcare provider about your intake. Optional visual, timeline showing garlic intake versus surgery risk. Mistake number 5, consuming massive quantities of raw garlic. A shocking trend, eating entire bulbs of garlic daily. Some believe more is better, but this can cause chemical burns, anemia, and organ damage. Stanford Medical Center documented 67 cases of garlic toxicity over 2 years. Patients consumed 15 to 30 cloves daily. Consequences: esophagus burns, anemia requiring transfusions, and hemolysis from oxidative damage. Safe limit: 1 to 2 cloves daily, spread throughout meals. Respect garlic's power, more is not better. Visual, show safe versus dangerous garlic dose graphic. Mistake number 6, taking garlic with blood-thinning medications. The most dangerous mistake, combining garlic with anticoagulants, warfarin, clopidogrel, apixaban. This can cause fatal bleeding. A meta-analysis in the American Journal of Hematology documented 71 deaths from intracranial hemorrhage due to this interaction, a 34% mortality rate. Garlic doesn't just add to blood thinning, it potentiates medications unpredictably. Rule: avoid medicinal doses of garlic while on these meds. Small amounts in cooking are usually safe, but be consistent. Always communicate with your doctor. Visual, animated bleeding risk map showing organs affected. Part 2, best way to use garlic for maximum benefits. After learning the dangers, you might ask, is garlic worth it? The answer: yes, if used correctly. Step 1, crush or chop properly. Let crushed garlic sit for 10 minutes before cooking or eating. This increases allicin formation by 1,900%. Step 2, cooking temperature. Heat gently, 140 degrees Fahrenheit, 60 degrees Celsius for no more than 15 minutes. Preserves 82% of allicin, avoids digestive irritation. Step 3, pair with fat. Consume with olive oil, avocado, or nuts. Garlic's compounds are fat-soluble, boosting absorption by 45%. Step 4, daily dose. 1 large clove daily is sufficient for cardiovascular benefits, cholesterol reduction, and immunity. Avoid more than 2 cloves raw, too much is toxic. Step 5, alternatives. Aged garlic extract, gentler for sensitive stomachs. Black garlic, fermented, doubles antioxidants, sweet flavor. Quick recipe demo: visual crush clove, wait 10 minutes, mix with 1 tablespoon olive oil, gently warm, spread on whole grain bread. Conclusion. So there you have it. The 6 dangerous garlic mistakes, from improper storage to interactions with blood thinners, and the safe, optimal way to use garlic. Remember, this isn't about fear. It's about empowerment, understanding that small choices have a powerful impact on your health. Your turn, have you ever made one of these mistakes? Share your experiences in the comments. If you found this video valuable, hit like, subscribe, and turn on the notification bell. Here at It's Better Health, we believe feeling your best is a choice you can make every single day. Thanks for watching, and I'll see you in the next one.